Good morning everyone, my name is Dr. Sharma and today we're going to be talking about something that might actually surprise you. Why getting more hair grafts during a hair transplant surgery isn't always better. Now let's break this down around the truth about graft numbers in hair transplantation. Your donor area, whatever part of the body you're taking your grafts from, the back, the sides, the beard, has a finite number of hair follicles. So think of it as a saving account. Once you use these follicles, they're not going to grow back. I've often found that many centers will promise 3,000 to 6,000 grafts in a single session. But here's what they're probably not telling you. Every minute your grafts spend outside your body, this affects their survival rate and hence your results. The longer the surgery, the more challenging it becomes to ensure each graft survives and grows properly. Quality matters more than quantity. Here's why. Each graft needs to be carefully handled and there must be proper placement, and that takes time. Natural looking results require precision. I've often been asked what are some questions individuals should ask their providers prior to proceeding, and these are a couple of the questions that I would recommend. Number one, how long will the surgery take? Number two, what's your plan about your future hair loss? Number three, will you need to take medications to maintain your results, particularly the native grafts? In my experience, sometimes doing fewer grafts in multiple sessions actually provides better, more natural looking results than trying to do everything at once. The other very important point we must always remember, if you are planning on doing 5,000 to 6,000 grafts in a center, please ask yourself, does your donor area actually support this? Do you have enough grafts for the back to actually look natural after you've been harvested? Think about your future self. Will you continue to lose more hair? Will you need another procedure later? And finally, what options are there for future treatments? Because in my experience, once you get a hair transplant, you normally like the results if it's done well, and patients normally want further procedures because they want to keep their quality of life up to this particular standard. Many clinics don't discuss these, but maintaining your native grafts with medication is just as important as the transplant itself. Now there are some nuances where we can have a bit of movement around this, but without this, your results might look incomplete as you continue to lose non-transplanted hair. Remember, the goal isn't to transplant as many grafts as possible in one day. The goal is to give you natural looking, long-lasting results that will look great for years to come. So we know that a lot of you watch from all over the world. So if you have any further questions, of course, it's not medical advice, but I can provide generalized commentary about particular questions using my own anecdotal experience. Thank you very, very much and have a wonderful day.